Hi, I'm Beth Battolino, CEO of Healthy Women. Thank you for joining us today on Healthy Women's first talk show, WomenTalk.
Hello and welcome to WomenTalk. I'm Beth Battolino, CEO of Healthy Women and your host of WomenTalk. We've partnered with the National Association of Nurse Practitioners in Women's Health to bring you 3 episodes on the important role nurse practitioners play in women's health, from contraceptive care and maternal health to menopause. In this 3rd episode in our series, we'll discuss the options to manage menopause and what women can do to support themselves through this transition. Joining us today for the discussion is Genevieve Hoffman. Genevieve is a women's health nurse practitioner and a certified menopause practitioner, which enables her to care for women throughout their lifespan, from pregnancy all the way through menopause. Thank you, Genevieve, for joining me for this important conversation about menopause. And we're going to dive right in. So oh my gosh, so glad to have you. This is I feel like this is such a timely topic. We're seeing so many more celebrities talk about menopause and their transition. We're also reading much more about menopause and hormone therapy. So I'm really excited to have you on our show today. Let's begin with having you explain your role as a women's health nurse practitioner and the specialty you have carved out in midlife health.
Yeah, thanks for giving me the chance to be here and to participate, because menopause really is having a moment. That big New York Times article, sort of everything has kind of just trickled down from there, and it's been, I think, just really important for women in general, but certainly for those of us who are making this transition and taking care of people making this transition. So, as a women's health nurse practitioner, I have specialty certification to very specifically take care of women's health issues. And we actually start taking care of girls at Menarche. And so, we have this kind of long period of time where we take care of people. And there's many of us now who are menopausal. And so, like many healthcare providers, we really get inadequate training about menopause. And so a few years ago, seeing this need, I decided to go to the North American Menopause Society. It's actually now called the Menopause Society, and do some extra certification to become a certified menopause practitioner and really refine my understanding of menopause to really help the people who were seeking answers in my day-to-day practice.
That's so great. How was that? How was going back and getting the certification? Did you?
I did. I really did enjoy it. It was it's a self-study kind of thing, where you just have to be up on the most current evidence-based recommendations and the literature. And it proved to be just very humbling, because I learned a lot in studying for that certification, and also being able to put that into practice. And so being able to provide patients with really good evidence-based recommendations to manage their menopausal symptoms.
No, it's awesome. And I love the fact that you did that, because that's the one thing that we continue to hear is that there are so many healthcare providers that are not up to date on midlife health, and especially that transition from menopause to postmenopause. So I think it is so important, and the Menopause Society has done such a great job at training. Their conferences is spot on, and being able to get that extra certification is so important, especially I feel like today, with the growing number of women that are going through midlife health right now. So thank you for doing that. Perimenopause, I want to talk about that a little bit. What are some of the symptoms women come to you for during this stage? Like, what are some that a lot of perimenopausal women are describing or coming to see you about?
Yeah, I think there's a lot of there's a lot of confusion and misconception about what menopause is, when it occurs. And so, from a clinical standpoint, we're menopausal when we haven't had a menstrual cycle in 12 months. So you kind of know your menopausal birthday 12 months after your final menstrual period. And there's this very variable time period before that happens that we call either the early part to the late part of the menopausal transition or perimenopause. And it's very variable from person to person. And some people may find that they're very symptomatic for just a few years, and other women may find that they're symptomatic for a decade. And the symptoms vary from person to person. Some of the big hallmark things that people will notice is cycle changes. I think that's one of the biggest ones. And you'll notice a change in the interval of the cycle, often a shortening before it kind of gets longer or you start skipping periods. Most people will also experience heavier menstrual bleeding, longer menstrual bleeding. And this is all because we're actually pretty estrogen dominant perimenopausally, which I think, again, you think menopause, lack of hormones, but actually we have lots of estrogen perimenopausally because that ovary is just trying to do its job. And so with that comes breast tenderness and acne, and I think emotional mood changes. Sometimes women will have a real worsening of like menstrual headaches. It's kind of a lot of those hormonal symptoms are heightened during the perimenopause.
So that's good to know that people are not going crazy, that this is something real, right? Because I can remember going through that and thinking like, what is happening to me right now? And then as we go through perimenopause and we transition more into menopause, there are options that are available. And I think this is a big thing for, especially with your practice now, like explaining options and making sure women feel that they're being heard and that they know that if they need something to help them during this transition, there are some safe options. Can you talk a little bit about that? And kind of, I would love for you to touch on hormone therapy today. Like what women need.
Yeah, I think that there are lots of options and there is no one size, fits all approach. So in the early 2000s, there was this big study that came out called the Women's Health Initiative. And so I trained kind of right before that study. I came into practice right before that study. So kind of pre-WHI, it was sort of like everybody should be on hormones forever for the rest of your life. They're great. And then this study came out in 2000, 2001, and basically it said hormone therapy is really, really dangerous. And so there was a really shift in practice, and the amount of hormone therapy prescriptions that were written decreased significantly. And then as part of this, you have this generation of healthcare providers who really received no training and have sort of lived in this time period for the last 20 years where hormone therapy was thought to be really dangerous and not okay. And we have re-examined a lot of that data. There's been new studies that have come out. And this is part of this renaissance of really re-looking at hormone therapy and its safety. So hormone therapy is definitely an option for most people to help make this menopausal transition. So I think we should definitely talk about that. But there's also lots of lifestyle stuff that we can do. And, things like diet and exercise and cognitive behavioral therapy and mindfulness, all of those things have also been shown to be really impactful to the menopause transition. And what I always tell my patients is those things are good for us regardless of where we are in menopause, right? They're just important, healthy lifestyle things. But the healthier we are going into the menopause transition, the healthier we're going to be for our lives. And the menopause transition is this huge cardiometabolic shift that happens for us. So the change in the hormonal milieu that we experience with menopause really is it's really important for our cardiometabolic health. And so premenopausally, the healthier we are cardiometabolically, kind of going through this transition and for kind of our lifespan, we want to have a healthy lifespan. It's all really important. So I talk a lot about this premenopausally or perimenopausally to my patients, the importance of exercising, the importance of eating well, decreasing, alcohol intake, not smoking. Those things I also think are really, really important and really impactful.
No, I do think, and you know what? I just connected the dots when you were talking about like transitioning into perimenopause and menopause and taking care of your health and the importance of diet and exercise. It's almost the same thing that we tell ourselves when you're getting ready to become pregnant or thinking about becoming pregnant, right? You need to take care of yourself. This is a new chapter. I feel like it's a new chapter as you go through perimenopause and menopause too. And making sure you take care of the whole you from head to toe is so important because it's going to make that transition even much more better and smoother, but also like post menopause, we still have women live so much longer than men, and like making sure that we're taking care of ourselves is just so important. So I love that pull through. I want to talk about so we talked a little bit about hormone therapy and that there's options and it's not one size fits all, but there's some newer options now on the market, non-hormonal. So those women that may have gone through breast cancer, for example, and would be prohibited to take hormone therapy, there are some new options. Would you mind talking a little bit about the non-hormonal options?
Yeah, I think that, again, we also think the only option out there is hormones. And so if you look at FDA approved options for managing vasomotor symptoms associated with the menopause transition, hormone therapy remains the gold standard. There's one SSRI, which is a selective serotonin reuptake inhibitor. That's an antidepressant, anti-anxiety medication called paroxetine that is also FDA approved to manage menopausal symptoms. And then there's a new FDA approved medication called fezolinetant. And this is a non-hormonal medication that is a neurokinin 3 antagonist, NK3 antagonist, I believe, and it works in the hypothalamus. So this, in our hypothalamus, in our brain, is where our temperature regulatory center is. And so when we don't have as much estrogen, it impacts the way that those neurons fire. And this medication works there. And it's from the studies, it's very, very effective and it's non-hormonal. So those are the FDA approved options. Now, we have long used other medications. So some of the other SSRIs, SNRIs, other antidepressant medications have also been shown to be efficacious to decrease hot flashing, as well as medications like gabapentin. So there are definitely options that are non-hormonal. And again, I think if your primary care provider, your internal medicine person, even if your OBGYN just is not well versed in this, I think as patients, we need to really self-advocate to find somebody who's a specialist who can help make these decisions and provide you with sort of some evidence to support what you decide to do. And the reason I say this too is that there's something about vasomotor symptoms that it's a sign of cardiovascular health. And women who have worse vasomotor symptoms also tend to have worse cardiometabolic parameters. And what we don't know is if we treat the hot flash, is treating the hot flash enough? Or is it, that's the kind of, we're not really sure yet. But I think there's really something to treating hot flashing for quality of life, but it also may be cardioprotective. And sleep is the other big one. People who don't sleep well have more inflammation, they do worse. And so we also have to treat them because if people aren't getting good sleep, everything else in their life kind of falls apart around it.
Oh my gosh. Yes. And I'm one of those people. So I will be, that's going to be our next episode is sleep. So Genevieve, say I'm a new patient and I'm coming to see you and I'm going through I feel like perimenopause, menopause. What are some of the recommendations that you would say to me that would be helpful to you? Does that make sense? So if I'm coming to see you, what would you say? How can I prepare for my visit?
Yeah. I think that's actually a really good question. One, you have to self-advocate. And I think it's really important that if you feel like there's something not right? Like women often, there's a great capacity for women to suffer. And so something is going on with us and we just know something's not right. So you have to self-advocate. I would write your symptoms down. What are the things that are bothering you? What are you noticing? How is it impacting your quality of life? How is it impacting your ability to do the things that you need to do throughout the day? And then I also think we can't just assume because somebody's 45 that what's going on with them is perimenopause, because I also think we do a lot of gaslighting of, you're perimenopausal, suck it up. This is just how it is. there can be other things that are going on with us besides our hormones, health-wise. And so, again, I think we can't forget that, yes, 45-year-olds are perimenopausal, and it can explain a lot of symptoms, but it doesn't necessarily explain all symptoms. And so we also need to not just make assumptions that, yeah, this is just hormonal, because we're more than just our hormones.
Oh my gosh, perfect. Thank you so much, Genevieve, for your role in women's health and for being a nurse practitioner in women's health. So needed and just so delightful to talk to you today, especially about a topic that's near and dear to healthy women's heart, menopause and perimenopause. And I really want to thank you for taking time out of your busy schedule to discuss the important role nurse practitioners play in women's health, particularly menopause. And I want to thank our audience for tuning in to this episode of Women Talk. For more information on this topic, please visit healthywomen.org and tune in here for the next episode of Women Talk.
Thank you.
Thank you.
Thanks for joining us for another episode of Women Talk. Stay tuned for more Healthy Women live events at www.healthywomen.org. You can also follow us at Healthy Women on Facebook, Twitter, YouTube, or LinkedIn, or follow us on Instagram at healthywomen.org. We'll see you next time.